Hello, everyone.
Hello.
Hello.
See David and I see Jeff. Can you hear me okay?
What? Yes.
Funny. Got a couple other folks who've already joined us. Early birds. Thomas and Daniel, can you hear us okay?
I'm sitting in for Daniel. I'm his proxy. He is in dental surgery right now.
He's away where?
He's in dental surgery right now. He had an emergency case.
Well, thank you for being his proxy and for sitting in.
Thank you.
And then Thomas Ullinger.
Yes, I'm here.
Great. You can hear us okay?
Yep.
Well, we're expecting a few other folks to join us, but my name is Melissa Green, and I'm the Deputy Director for Communications and Recruitment for the Clinical Scholars Program. And I'm thrilled that you're able to join us. Let's see. And we have joining us two of our current Clinical Scholars Fellows who happen to be dentists and the only dentist currently in our program. So our hope is that with a call like the one we're going to have today, you'll hear more about the program and either consider applying or sharing the info with others in your network.
Great.
So I have a couple of slides that I can share during this that kind of, because some folks are visual learners or a combination and prefer to have some visual information as they're hearing about things, and we'll also be able to share some links with you as well. So I'll share a short slide that's just meant to be an overview, but we can stop and answer the questions at any time.
Hi, this is Jennifer joining.
Hi, Jennifer. Thanks for joining us.
Of course.
Hi, Jennifer.
Hi.
Hi, Jennifer.
Hi, everybody.
So Jennifer, you're joining us from?
From the phone, UNC Chapel Hill.
UNC Chapel Hill.
Mm-hmm.
Where it's
School of Dentistry and Medicine.
Okay.
Yep. How much more information would you like? I'm happy to share.
That works.
I can fill her in, Jennifer. This
Hello.
is Dave.
Hello, this is Janet.
Hi, Janet.
Janet? Hey.
Great. And we have Daniel and Thomas joining us. Daniel and Thomas, Daniel's proxy, and Thomas, where are you calling in?
Hi, Daniel's proxy. I'm calling from San Francisco.
From San Francisco. Okay. That's as technical as we'll get for now. And then how about Thomas? Where are you joining us from?
San Diego, California.
Oh, okay. So Jeff's probably the only one that's having to deal with negative degrees today. Well, we're with you in spirit.
That was generous. Even spirit is cold.
Minus 66 yesterday with wind chill. Pretty
No,
cool.
no. And you walked outside.
No, I stayed home. The whole university closed yesterday.
Okay, good.
And all the schools and the postal system and everything.
And Chris Brenda Mule, where are you joining us from? You're on mute right now, Chris, so when you're able, you can let us know.
He's in Phoenix. Or
And he
she.
doesn't have a mic. Hi, Chris.
Awesome. So, and then we have Dr. Janet Sutherland. Where are you joining us from today?
I am joining you from the University of Texas Medical Branch in Galveston, Texas.
Great. Well, Dr. Sutherland is one of our National Advisory Committee members, so we're excited to have her join us today to share her reflections as someone who reviews the applications for the Clinical Scholars Program, and also sharing her expertise as a dentist and why this might be a valuable experience for others to consider. And then also,
Okay. Okay.
and then also joining us are two of our current fellows, Dr. Jeffrey Karp, who is a dentist in Minnesota, and they'll both introduce themselves and describe their work, and David Resnick, who is a dentist at Grady in Atlanta, Georgia. So they are currently a part of two clinical scholars teams. You'll hear a little bit more about the teams, but also about their experience in the program during our time today. And then also, they will be able to answer questions that you have about experiences, and between myself and Dr. Sutherland will be able to share some other reflections about the review process and application process. So I see a couple of the folks have joined us since we started. Do you want to introduce yourselves? And Albert Abena. All right, Albert, you might not, we can't hear you. So anybody else who joined us want to introduce and share your name and where you're located? All right, so maybe folks are stepping away or just joining us. So let's go ahead and just get started. So can folks see a slide, the slide that has our clinical scholars info on that? So that's visible, great. So as I mentioned, we want to share information with you about Robert Johnson Foundation's Clinical Scholars Program. And we'll actually share a little information about all four of the Robert Wood Johnson Foundation's leadership programs for a better health, provide a brief overview of the Clinical Scholars Program, move into the experiences, the projects and experiences that our current fellows who are dentists have had in the program, and then answer any questions you have and tell you a little bit more about how you can be a part of this program.
Excellent.
Great. So if you're likely already familiar with Robert Wood Johnson Foundation, they are a health philanthropy that have been around for more than 40 years. More recently, their portfolio has included the development of a suite of programs called the Leadership for Better Health programs. And these are 4 leadership programs that focus on building a culture of health. And this is this framework that essentially is about everyone living the best and healthiest life possible, but recognizing that in order to do that, we need to be thinking about new strategies that are different than what we've done before, and working outside of the silos that traditionally our systems have trained us in, and also embracing the complexity and thinking about the complex health equity issues that are around us every day now, and thinking about approaches that are inclusive, that recognize diversity and also equity, and that we also and that these individuals who participate in these programs or who have ideas and that can help improve health in our communities, that these be folks who already have some interest, but also get some training on how to take their leadership and influence to the next level. And so I briefly will share with you the 4 programs, because I believe that hopefully most of you are eligible for clinical scholars, but I believe that most of you also know somebody who might be eligible for a good fit for one of the other leadership programs. And if we're really talking about building a culture of health, we have to kind of bring together like a cadre of leaders who are from a range of different sectors and clinical disciplines. So the first program is called Health Policy Research Scholars, and it's a program for doctoral students who are getting their PhD. So in their first year of their program, they apply to this program and get up to 4 years of leadership training, health policy training, and some grant funding support in addition to the discipline area that they're training in. And then the second program is called Interdisciplinary Research Leaders, and it's a program for teams of 3. And those teams include 2 researchers and 1 community partner or a community advocate. And collectively, those 3 team members are coming together to identify, to address a health equity issue using an action-oriented research process. So the idea is that the research questions are very much informed by the community that's served, and at the end of that time or during that time, there's actually some movement on those research issues. This third program is called Culture of Health Leaders, and it's a program for individual community advocates from really any sector. So, I mean, you can have multiple degrees, you can have no degrees, but have a passion for improving health in your communities. Folks can be from the IT world, from education, business, transportation, health. So really everybody has potentially an interest and impact in, and it has a potential to impact health in our communities. And then the fourth program is the Clinical Scholars Program that we'll talk, as we continue, we'll talk more about. And this is a program for teams of 2 to 5 providers who are working together to address a health equity issue in their home community. And so each of the programs, well, Health Policy Research Scholars Program is a program that is 4 years, and this year they are restructuring and won't accept applications for 2019, but they'll reopen that process starting in 2020. And then the other 3 programs are 3-year programs, and they also provide funding and leadership training to the individuals that are in those programs. So the website that we have listed below is a website that links you to a landing page for all 4 of the programs. So that one page will be a great resource to share with folks in your community. So I'm going to pause there and ask, are there specific questions about the suite of programs or the foundation, or in particularly the first 3 programs, before we move on to more about the Clinical Scholars Program? Okay, and I'm just going to share with you the landing page for the all 4 leadership programs, should you want to copy and paste that. So the Clinical Scholars Program is a program for healthcare providers, and for this program you have to be mid-career, which means that you have to have at least 5 years of clinical experience. Doesn't mean you have to have only 5 years, and there is no maximum number of years of experience. But you do also have to be active, and for us that means either seeing patients or clients or supervising providers in your discipline area, or training the next generation of providers in your area of discipline. The types of disciplines that are eligible for clinical scholars is quite varied, And you can see here that some of those disciplines include, but are not an exhaustive list of allied health professions, and that's the range of physical therapists, occupational therapists, and many more. It includes dentistry, which is why we're having the call tonight, and medicine, nursing, pharmacy, social work, and veterinary medicine. And when folks apply to the program, they can be in the same organization, or they can be split across a couple of organizations, and you'll hear an example of each of those tonight. They can be brand new groups that have just come together because of an idea, or they can have been working together for quite a bit of time. And they, almost all of our teams, everybody who applies to Clinical Scholars has to be a clinician, but almost all of our teams have extended members of their team that are helping to make their project happen. They're core to the implementation of their work. And so there is that option of having those individuals who are part of your team, but they do not participate in the leadership components that we'll share. Each team is selected based on the wicked problem they identify, and this is a complex health issue, a health equity issue, and there's a wide range of health equity issues that could be identified, and also the team that they've assembled to address that health equity issue. So those are the primary components that we're looking at when we were reviewing applications. And so I'll pause right there to see if there are any comments or questions or comments that Jeff, David, or Janet want to share about looking forward when we're looking at the program.
I don't have any right now, Melissa.
Okay.
No, and the only thing I can say is that mid-career is a long definition. We're all working a little bit longer, so don't think you might be too mature to try this. It's been a remarkable experience.
That is definitely one of the common myths I hear when I tell people about the program. They say I'm too old. So it's unlikely that somebody would be too old for this program, as long as they're willing to work on their leadership development and have an interest of continuing to make a difference in their careers.
Mm-hmm.
So I just want to briefly talk about what our program is, and we have a more detailed webinar that goes into this information, and we also have a lot of this on our website as well. But just briefly, our program is a 3-year program, and teams receive up to $525,000 per team for addressing their wicked problem project. And so that money is determined based on how many providers are on their team. So if you have a team of 2 providers, your team receives $70,000 each year for the 3 years of the program. And if you have a team of 5, your team receives $175,000 each year of the program. And and the teams can use those funds for buying out portions of their time to do what they say they're going to do as a part of their project, to also work on their leadership development as individuals and as a team. And also they can use some of those resources to help support members of their team who are not clinicians. All of our teams work from their home communities. Nobody relocates to be a part of our program. Nobody quits their existing job to be a part of our program. And our fellows come together 3 times as a requirement for our program. And during those 3 times, the fellows are receiving some intensive on-site training around leadership to develop their own leadership skills. 2 of those sessions are usually in the Durham, North Carolina region. And then the 3rd meeting is in conjunction with the other 3 programs that I shared earlier. So that might be we just had our meeting in Indianapolis in January, and it went fairly well considering we were in Indianapolis in January. So 600 leaders from around the country who are focused on improving health in their communities were able to share the work that they're working on and network with each other. So I would say in total that ends up being about 2 weeks a year that our fellows are coming together for the on-site training. And then in between our on-site trainings, our fellows spend about 2 hours a week on distance learning, and that's not every week is the same activity. Some weeks, some parts of that time might be readings that the fellows are completing as relates to their leadership development. About once a year, we have a book club for each cohort. Folks might be using that time to participate in a live webinar on a leadership topic, or participating in a coaching session with either the executive coach that each team member has access to, or their team coach that each team has access to help them shape their project and work through troubleshoot different issues. So I'm going to pause there to see if there are any comments or questions. And then we'll move into an example of what our current fellows are actually doing after I share with you a brief snapshot of our program. So right now there are 96 fellows in our program. So our program is pretty young. The program's only 3 years old. We're in the process of recruiting for our fourth cohort. So we currently have 27 teams. And as you can see here, the majority of folks are in 3- and 4-person teams. And we have heard from some of our teams that more people you have on your team, not only do you have access to more funding resources, but you also can troubleshoot together collectively on those issues in a slightly different way than when you have a smaller team. You can also see from the slide where our current teams are located, and we would like to continue to expand where our teams are located so that we have teams representing all of the U.S. states and territories. And then you can also see the age range of our fellows. So this definitely is a mid-career fellowship for folks to participate in. And so in order for folks to have at least those 5 years of clinical experience, our folks tend to be more mid-range in terms of their ages. Currently, most of our fellows are women, and about a third of them are practicing in urban areas. And then on the right, you can see the disciplines that are currently represented in our program. And hence, one of the reasons we're having today's Q&A is we definitely want to increase the number of dentists who know about our program and participate in our program. But this list also kind of gives you an idea of who might be on your team as you kind of think through what your wicked problem is and who to assemble on your team. And then the last graphic on here shows you some of the racial diversity in our current cohort. So it leads us into how can we get more dentists to participate in our program and apply to our program, because like a lottery ticket, you got to play to pay, or you got to play to pay. So this slide is kind of a composite of the current programs that we actually have in the clinical scholars that are focused on oral health. And so David, if you could share with us a brief overview of Team OICAN and the work that you're doing.
That would be great. Our project came together, the PI of our project is actually Charles Moore, who's an otolaryngologist or ENT physician. And the other team member is Hope Businius, who is a nurse practitioner. Our issue came up that our emergency department at Grady were seeing a remarkable percentage, between 5 and 7% of the visits were non-traumatic dental visits. In other words, not accidents, not trauma, but toothaches. And as we all know, the emergency room is not the place to get care for, or any kind of definitive care for dental issues. So we wanted to expand access to care using a combination of teaching, technology, and then expanding a residency program that I run. So we have 4 residents that are in 2 programs. Beginning this July, we're actually adding another program, and 2 more residents will be coming. We've created an app that is in the beta testing phase now. And what that app does is actually look at oral health related quality of life. So it's an OHIP 14 indicator. It also has a couple questions on head and neck cancer and one on blood pressure. This goes into a repository and can be used for research or can be used chairside. There's several uses that we're doing. We are on a website. We do have social media. But our whole goal was to increase access to care. So we even created a dental diversion project that goes from the emergency department to now more than one clinic, but a couple clinics, so we can handle the load. And we try to do that before people register. So because of mentality, we don't want people to get that $800 fee that just to get an exam and spend several hours in our emergency department. So that was the reason we got started with the project. I have been honestly amazed that this has been one of the highlights of my career, and I'm not really a mid provider. I'm sort of on the older end, but glad to know I'm not the oldest. I did get to see the age range finally. But the leadership skills that you gain from here are remarkable. The experience of working with the other teams is remarkable. This is something that literally has changed my leadership style. I wish I would have had this maybe 25 years ago. So I encourage everyone to really look at this project. But we really have made a difference. We're continuing to make a difference. We're training PAs, nurse practitioners. We actually work with the Georgia legislature to educate some folks. So we now have the general supervision for dental hygienists performing preventive care. And we created the toolkit for implementation. And that was done by a PGY2, or a second-year resident of mine, who actually became the Georgia Dental Hygiene Association Dentist of the Year for her work involved in this program. So literally, we're trying to work on preventive care, starting school-based programs, but also bi-directional, because we want to take care of the child as well as the caregiver. So I think that gives you a bit of an overview of some of the things that we're doing. We're also teaching head and neck cancer exams, and hopefully soon telemedicine. So we're doing a lot of things here. You're on mute. So I'll talk for, there you go. Melissa's not on mute anymore.
Great. Thanks for that overview of the work that your team is doing, and introduction, and also introducing your team. Jeff, do you want to similarly introduce your team and share a little bit about your project?
Sure. So my name is Jeff Karp. I'm a pediatric dentist and residency director at the University of Minnesota up here in the frozen tundra. And we're Team Minnie Mouths. My co-teammates, I serve as a project lead for our oral health focused project. My colleagues are Peter Scow, who's a pediatrician and health services researcher, and Mark DeRuyter, who is a dual-trained audiologist and speech-language pathologist. Our project started at the University of Minnesota. We're now a 2-site program in the sense that Mark has moved on to the University of Arizona for his work. Our project is focused around children with special healthcare needs in Minnesota, and the idea of trying to build both a workforce capacity and also a network for both community building and resources, so more providers will care for this population. Our main strategy for our work is the use of Project ECHO telementoring. For those of you that aren't familiar with Project ECHO, it started in New Mexico in the early 2000s, and it's meant to move knowledge instead of patients. And so the goal is that you kind of flip case-based learning on its head, such that providers in the community are presenting their cases to a network of people through video conferencing, and helps them to feel empowered and to care for their patients in their home communities. So we're working with dentists and dental providers, pediatric providers, allied health professionals to provide knowledge, to provide a community and a resource system, and to help them to care for their patients in their clinics and in their practices. We're also working closely with other organizations. Our project is housed within the Office of Continuing Dental Education at the University of Minnesota School of Dentistry. So we're able to kind of leverage the continuing dental education aspect of Project ECHO and to reach out across our state to all of our dental providers. We're also working with Family Voices of Minnesota to have a family perspective in all the care that we're providing and the knowledge sharing that we're doing. And as I said, we're really working to just build a larger community of individuals caring for children with special health care needs. Oral health in this population is the second most common unmet health need amongst these children. I will stop there for now, and I'll field questions as we go.
So one of the questions that has been asked that I think others may ask as well, and I've heard from, is how do I need to build my team by myself, or will I be paired with someone? if somebody else got selected. And so we do ask folks to, you apply as a team. So you identify your wicked problem, and then as your approach to that wicked problem, and then you also identify who's best suited to be on that team. And I wonder if David and Jeff, if you could share a little bit about how your teams came together, like
There's a lot of feedback.
So that was on Esther's side. So Esther, I just muted you because of a lot of feedback, but I can unmute you if you have a specific question. Just let me know in the chat box.
I can go first if you want, Melissa. So our team came together. I had learned of the clinical scholars. Obviously, we're in cohort 1, so we were the first group. And so we really couldn't reach out to other existing clinical scholars and kind of gain some more information that way. So I had learned about it through the kind of the call for application and through some other colleagues. And so for me, I reached out to individuals across the dental school and other places because we really want an interdisciplinary and interprofessional team. And especially a team that's not really working with another dentist, although it would have been a nice part of our project, it wasn't the same feeling. And so I kind of looked outside of dentistry altogether. I met Peter through joint colleagues at the LEN program, Leadership Education Neurodevelopmental Disabilities program. He also knew Mark through that same channel, and we also knew of Mark through our cleft and craniofacial team. And so that's kind of how we came together. We had not been colleagues working together on clinical teams before this, and we met in person for the first time 12 days before the application was due. So we did a lot of work over a short period of time to apply, but it came together well, and we've gelled well as a team. You learn a lot about each other through clinical scholars and how you approach life and your leadership and how you work. And we've turned out to be a really cohesive team based on both our similarities and our differences.
Sorry to have left you all for a moment. My internet went out for a second. Our activity started when Dr. Moore, Charles called me up and asked me if I was mid-career. I just had cervical fusion and I laughed. I said, physically, maybe not, but spiritually, yes. And I did not know Hope, the third member of the team. So we actually came together, having Charles as the centerpiece, and we're literally able to come up. We all knew about the project because Charles works at the hospital. Hope has dealt with issues in access to care. Access to dental care is the number one reason that, or dental caries is the number one reason kids miss school. So that was a big issue. And we really are trying to target low income, low resource, and minority individuals to increase access to care. And finding a physician who had the same passion about it and a nurse practitioner who had the same passion about the issue as I did, really created a successful model. Charles and I worked before. The three of us will work much past this exercise or this 3-year commitment that we've given so far, because we're already on the sustainability component.
Great. What advice would you, and Janet may have suggestions as well, what advice would you have for someone who is interested in applying to clinical scholars and is not sure how to build their team? Like, I mean, you talked about specifically where you've gone. What would you suggest for someone who's like, well, how do I find my team?
I'll take a first stab at that because I've been sort of recruiting people for this project. I don't know any clinical provider, at least in public health, that isn't facing wicked problems in their communities. My main job is I work in an HIV program, and I've been there for several years. So access to oral health care for people with HIV has always been a huge issue. Because of Charles bringing and being a part of the medical leadership at the hospital, I was aware of what was going on in the emergency department, as was Charles. And to use the skill set that I had gained by treating one patient population, I thought, why not spread out and see what we can do? So I think sometimes it's people that you work with, sometimes it's people that you might have mutual interest with. And you're trying to address whatever that issue might be. And it's not just addressing the wicked problem, because you literally have to be willing to learn. And you have to be willing to put the time in to make not only your project a success, but make the learning experience a success as well.
Great advice. Was there anything else?
This is Janet. Yeah. I'm going to chime in. I was just trying to make sure my camera was right. I don't know what it's really pointing to. It's pointing to me now, so I can actually speak. I would say that, you know, part of this process is really understanding different roles and responsibilities of individuals, and really a interprofessional exercise, but also a team building exercise, if you will. And so it's very important that you identify individuals that you know, or other folks know, who are good collaborators and team members. Because you don't want to kind of just grab people and put them together in a team and then realize the team dynamics are not really good. And so I think that's something that you really need to take into consideration when you're trying to build your team. And then certainly your wicked problem. Who are the key individuals that you should be contacting or collaborating with in order to address it at whatever level you decide that is.
That's all great advice. Yes. Well, and I imagine all teams learn about themselves and their teams once they're in the program. Even if you feel like you know somebody already, it's like another layer. It's the layers of the onion. But it's great to think about, this is somebody I'm committing to work with for three years if I haven't already. Great. Any questions from anyone?
Yes, I have a question. This is Tom Olinger. I just wanted to be sure that we're talking about, this is a part-time project. In other words, you and all of your team members have other full-time jobs. This is on top, over and above, and on top of that, correct?
Yes, this is over and above. My full-time job is Chief of Dental Medicine at Grady Health System in Atlanta, and I run an HIV oral health program there, and I'm very involved in HIV care in Atlanta, and hopefully made impacts in different parts of the country. This is something in addition to what I'm doing, but it does cover a portion of your salary, so it does give me time during the day to actually do some of this work that I need to get done. And you know, we meet as a team every couple of weeks, face to face, so we actually can see what our issues are, because we are located in the same city, and two of us work at the same hospital, but we are also from different organizations. I'm an employee of Grady Health System. Charles is chief of ENT at Grady, but an Emory School of Medicine professor, and Hope is a professor at the School of Nursing. And so we literally tried to get all of the different aspects that we thought could make a difference in addressing this problem. But it's above what you do. It's not a job. It's how do you get your passion, and you know that there's a problem, and how do you build your skill set and get your team to function and address the problem and make a difference. I think that everybody who gets involved in Clinical Scholars truly wants to make a difference for those that we're serving, and we definitely want to focus on health equity. We want to make sure that outcomes are the same, or based, it doesn't matter what your race is, your ethnicity, or any of the other issues that come in. So it's a remarkable program that you continue to learn, and it makes me better at the job that I do full-time.
Well, thank you very much. I'm definitely interested. So unless I hear otherwise sometime during this webinar, I'm probably going to make an attempt at applying. So thank you.
That's good. Yeah, and just recognize as well, as a follow-up to that, that there's a lot of latitude in how the money is utilized, and certainly around the project that you're doing. Some of the teams that we work with in our cohort, their project is really their everyday practice as well. And so sometimes that money can be used also to support personnel as well. For us, as an example, in our project, we have a kind of a daily operations person who has a larger time effort to the project than we do as the clinical scholars. And that's a way to kind of make sure that the daily work is moving along and we're progressing with the project. So there's a lot of latitude there. But it's definitely an additional thing to do. And the leadership part of this, the project and the leadership part are really probably a 50-50 type of thing. It's not kind of a 90% project, 10% leadership. There's a good amount on both sides to recognize as well. But I think the two work together, and everything I've learned on the leadership side supports my work in the project, but also my daily work as a middle manager in an academic setting.
Well, I suspect both of you gentlemen are already leaders and have been throughout your career. And it's kind of a similar situation for me. I've been involved in many things. My present position is I'm Chief Dental Officer for San Diego County. And much of what you've discussed are projects that I'm already working on in one capacity or another. Although, believe it or not, this is a part-time position. So this might segue very well into what I'm doing. So we'll see. We'll fill out an application, see if I can put a team together, and we'll go from there.
That is wonderful to hear. I'm an RDHAP, and I'm in Fresno County. So when I hear that somebody from San Diego County is also on this call, that's reassuring that California is being represented. I'm working with several counties looking at utilizing RDHAPs who are Medicaid dental providers in school-based sealant programs. So hearing that because what we come back to is, first of all, funding, and then second of all, opportunity within schools.
There's one of my team members right there.
Right. Can you introduce yourself? That's great. Could you introduce yourself? I don't think I got your name.
Oh, I'm sorry. My name is Rhoda Gonzalez. I'm an RDHAP in California, specifically in Fresno, which is the Central Valley. So I've been working with Fresno County. I've had meetings with Tulare County, Kings County. I spoke this morning with Placer County, and I've spoken with San Luis. And, yesterday I had a call with UCSF. So I know in California, we've got a big push with this oral health programs within each county with Prop 56 to establish a better way to reach our children younger in prevention. So one of the ideas that's been floated around that I'm collaborating with is school-based sealant programs.
Yeah, and the thing that we have in California too is over the entire lifespan. It isn't just children, so that really opens things up, and this would segue very beautifully into what we're doing here. So.
And we wish that we were California sometimes in Georgia, but not quite there. Our Medicaid program from adults only covers extractions, which is why we're in the situation we're in here. And one of the big points that I think we're actually starting, we have a school-based sealant program utilizing a dental hygienist. So I'm very thrilled about that, that we were able to access. But my whole key is we take care of kids, and then, at least in the South, and then when they become adults, we don't have resource. And so what we're trying to do is make sure that the practices are successful enough that we can offer care to the caregivers in an FQHC model or a health center model. So trying to get the families so we can break this chain of, after 21, there's nothing for you. So we're really looking to do that in Georgia, and it's going to take a lifelong effort, I have a feeling.
As you think about your teams, also think about, for us, we're 3 academics in a university setting, and there's some strength to that, but there's also a lot of blind spots. And so I would recommend, if you look kind of cross-sector, if you're all working kind of at the level of administration in a state or a county, kind of looking at community level or provider level or others to make those connections. And certainly people as far different from us in dentistry as possible, because of the perspective is really amazing. You probably saw that graph of all the different provider types, and many social workers and psychologists are in the program, and they really bring a lot with regards to behavior change and social work and communication and kind of community support. And so you'll see that listing there is really helpful. And many others that are probably not on the list that are not yet represented that also would be great team members too.
Yep.
Great. Is there anybody on the call who has not introduced themselves? Or has other questions?
It's a great opportunity. Time to ask questions.
I see 13 participants.
Hmm?
I see 13 participants.
I see 13 participants.
Yeah.
Hello.
Hello?
Okay, can you guys hear me okay?
Yes.
We can.
Okay,
Yeah.
all right. My name is Esther Lopez. I am a private practitioner in Oak Park, Illinois. I also, for about 9 years, was involved with Goldie's Place, which is a homeless agency in the city of Chicago that also provides oral care for adults. We have worked with UIC College of Dentistry, getting students into our clinic, exposing them to different things that they can do with underserved populations. I am working on my MPH. I'm very interested in this program. I wouldn't know where to start, but I'm just here to just kind of get ideas and to see what I can do in public health with the things that I've already been involved with.
Excellent. Very good.
Great.
Please feel free to use me.
I just have a suggestion for you. If you can identify what your wicked problem might be, that may help you identify who those team members might be for you.
And this may
Because
seem
it sounds like homelessness.
yes, it is working with homeless adults. What is the definition of the wicked problem?
I'll let Melissa go over that again.
Okay.
When you see it in text, it might look a little different. I don't have it memorized verbatim, but essentially it's any complex health equity issue. So access to housing is definitely a health equity issue. So so anything that focuses on systemic issues that impact people's health. So anything connected to social determinants of health, anything that's related to equity issues from a gender perspective, race and ethnicity perspective, and ability perspective. Wicked problems really transcend many of those different types of conditions. So yeah, homelessness seems to be getting a lot of attention of late, and I imagine that we will get some applications around homelessness. So and I would echo what Janet has shared about. It's important for you to think about what wicked problem you are passionate about, but as you're assembling your team, also being flexible enough to embrace the ideas that the other clinicians from other disciplines will have, so that you're co-creating something, as opposed to this is my idea, who wants to be on board. I mean, it can work either way, but I think that really if you're open to folks coming and bringing their expertise, then you really are creating kind of that that synergy across your team.
It makes you better. I mean, when you're getting other people's perspectives and they're dealing with similar issues, sometimes you might feel like you're on a little bit of an island and that you don't know. I always say I grew up in an interdisciplinary care environment because of where I work, but this literally has enhanced my patient care because I have a great relationship with Dr. Moore. I can send patients over there. We are hooked up together visually. It just, you really do broaden your perspective on what other people see the problems to be, and then gain a interest or other perspectives on how it can be dealt with. And I don't know that without having such a wide group that we have, not mentioning the community involvement that we seek and using MPH students and all the different resources we've tried to gather, I think that none of us as an individual could have made the difference that this team does. And I don't know that this team would function as well without all the leadership training that we get as a component of this. You really get to know yourself better. You might know your strengths and your weaknesses a little bit better. But identifying that wicked problem, the thing that you're passionate about, that you really want to make a difference about, is vital to make this a success. And regretfully, in my community, access to oral health care is a huge issue. and won't be solved in our 3 years, but we're not stopping. We're going to continue on until we made a dent, a bigger dent in the unmet need.
Great. We have one other person who's joined us who has not introduced himself, Binyad, who is in Ohio. Can you introduce yourself?
Melissa, can you hear me?
Yes.
Yes.
Okay. Hey, Jeff, Dr. Resnick, how are you?
Good.
Good, thank you. I'm a pediatric dentist, and I'm dual trained in pediatric dentistry and dental public health. I work in a tri-state area, which is Ohio, West Virginia, and Kentucky. I work for a community health center, do some hospital cases for both special needs and children. Work with many projects with the Ohio Medicaid and also the community health centers in Ohio. I'm on their leadership, clinical leadership team for all the community health centers, anything related to oral health. So some of the projects I'm working on are the quality issues, pay for performance, but also anything as I talked about federally qualified health centers and medical dental integration. And I'm kind of throwing a lot of the usual words out there, but I think relationships are different for each state and each project and among different organizations.
Great. Well, I know Jeff is glad to hear you on the call because he was definitely vouching for more pediatric dentists to take advantage of clinical scholarship as an opportunity. And you had shared in the chat box that you were searching for potential team members, but it sounds like your collaborating organizations with the community health centers and the federally qualified health center might be at least a place to start.
Yes, and as I said, I think one of the major problems in the area that I am is it's kind of ground zero for opioid epidemic. We all know that. But some of most of the families that we end up seeing in our health centers, like academic centers, are these families who are affected, and oral health is just a very small part of the overall care issues that goes on with these families. So I want to be part of it, not just oral health, but combining and being part of the whole team. And that's where the skill set that I would require is what I'm looking for.
Great. Well, and I see that Jeff and David have put their email addresses as folks to help you maybe think through ideas or be a resource. And you shared that you've known Jeff for a little bit of time since he became a dentist. So for over almost, for so you've known him. So go ahead.
I'm sorry, nothing.
Are there other questions or comments?
Melissa, one comment is there any way, let's say I could not find anybody else in the team members, but would I be selected based upon my credentials, or would it be more of a project that I am interested in?
That's a really good question. So that each team, you're selected as a team. So you'd have to have your idea and your team together. So teams are reviewed and selected as a package. So, good, bad, or indifferent. So it is important to find those other members of your team. And Jeff and David gave examples of kind of knowing parts of their team or not knowing everybody and pulling that together. We wouldn't recommend, 12 days ahead of time, but it has happened, and folks have had success with putting together an application last minute. But you do have to identify who's going to be on your team as you're preparing your application. So as a part of the application, each team member also provides their resume or CV, and they also submit a personal statement describing their leadership aspirations and how this program might help them do that. That's been
Okay.
excuse for David and Jeff to remember way back, almost 3 years ago what that might have looked like. But that's definitely a core component of the program. And our reviewers are looking at your idea, but then they're also looking at who have you put on your team and what do people say in their personal statements. And I will say that in past review processes, there have been teams that have a great idea, but nobody talks about their leadership development, or they use the personal statements to talk about what they've done, but not what they want to do. And
Okay.
how leadership is an important piece of their future development. So, I mean, this program is 50% grant money, but 50% leadership development. That's a really core component of our program, and we're looking at that in the review process. And Janet may have other reflections about that, as she's helped review applications these last couple of years. And
Absolutely. I think it's very critical, one, that you have a good wicked problem that you've identified, that you have a team. That team is really clear about what it is you would like to achieve on both sides as it relates to addressing the wicked problem, but also in terms of leadership. And so if you have those components and have worked through that fairly well, then I think your application would be very competitive.
Sounds like, is it fair enough to say that these present scholars already had a project in mind, or a project that they were working on, and then they got together to apply for the scholarship program?
I'll let David and Jeff speak to that.
I can speak for our project. There was nothing in place at all. In fact, 2 weeks before I found my current teammates, I was going to do a different project. Now, both of these related to my daily work. The other would have been in cleft and craniofacial care, and maybe it would have led me down the same path. But yeah, that's certainly part of the process of. I mean, you want to find people that are not just interested in joining your team, but really people that are interested in the work before that. We're also talking here, you're looking at 2 teams that are oral health focused teams. There's nothing that says that you couldn't be on a different focused team being a dentist. Just like Charles Moore is the leader of a team as an ENT doctor, right? Or there's other teams that have different leaders as well. So, but yeah, from our perspective, from my team, as I said, we didn't know each other, and we were all working with this population. So it wasn't that we were starting a new kind of population to care for, but how we were caring for them really did not in any way connect the 3 of us together. We were doing separate things.
I think it can be either or. I've talked to some people that work at some clinics I'm aware of that are already working together about applying. I've talked to some individuals who need to put a team together. Like I said, Charles and I had worked together, and Charles and Hope had worked together, and I had not met Hope until we met to discuss this. And she's fabulous. And so it was no issue. And we actually have been able to depend on each other's strengths. And I think that's another part of growing through this process, that one person might be really good at, for instance, Hope is our technology expert. Who would know that our nurse practitioner who created this blood pressure program for children with all these thousands and thousands of downloads would be useful in us creating a program. There's just so much that we all wanted. We all knew that this was a problem based on our clinical experience, and then we put 3 different perspectives together, which plus many others down the road, but 3 different perspectives on how do we want to literally tackle it. And that was well before we put in our application. We've took this application very seriously. There's if you get to a certain point, I guess there is a video interview. I can honestly say we rehearsed. I'm not the most rehearsing kind of person, as the folks on the call know, and so that was a challenge. But it really did come in. It came in handy. It was really quite helpful. And now we rehearse for everything. But it's just a wonderful process. I really hope that the people on this call will share this information. There needs to be more oral health people. You don't need to be a dentist. A dental hygienist, fabulous, especially if you're looking at new models of care, which parts of the country won't see anytime soon. I think there's just wonderful ways that we can make a difference in the overall well-being of those we care for and those who have access issues or having health equity issues. It really, as I said, it's a once-in-a-lifetime experience, and I'm very glad that our team was chosen.
I see it. I second that as well. To give you one other perspective from another team in our cohort, which is kind of a different approach, which is there's a group in New York that have started a transgender health center, and they've been working together, as a group for several years before this, and that is their daily work. And really, what the project has allowed them to do is to have resources and support, in addition to the leadership training, to really accelerate the growth and maturation of their center. And I think they recently gave a presentation to our group, and I mean they've presenting their work at all types of international meetings and a whole variety of things, and all that is partly because of the intent that they came to the clinical scholars with, and with the support and resources that they've been given. So there's lots of ways to look at this. If you can leave with one word from this, think of the word curiosity, and that will lead you in different ways than just thinking the same way. I think you guys are all talking about projects that are certainly viable projects and definitely needed, but there might even be things that are even more innovative. So think innovative as well, and think about things that if you were to give somebody a toolkit or a roadmap and they took it to their community or their state, that they could do the same thing pretty quickly and without a lot of the same troubles that you might encounter along the way.
Hear, hear. That was really well put.
Great point. Yeah, these are great ideas, but definitely think about leveraging. And those are two great examples. And I'll just share that I had a similar call to generate more interest around pharmacists, and we currently have 4 pharmacists in our program, but really only one of them is working in her traditional role as a pharmacist in her program, and it's focused more on pharmacy closures. But when we think about the multiple roles that you can play, and that was something that both that Jeff has mentioned. So there's quite a bit of flexibility. The idea here with clinical scholars is that you are experts in your home communities because you are clinicians, but it doesn't mean that you have to be identified exclusively in that role as you think about the wicked problems that you see in your home community. I've talked with somebody who's a veterinarian who wants to work on pipeline development in their community. So there's a wide range of different ways that you can apply your skill set as leaders in your community. So we've kind of intertwined reflections on the program and recommendations already. I don't know if there's anything else that you had initially on the slide that we've used prior, Jeff, that you wanted to share.
I can go through this real quick. I'll just say that just-in-time learning is, every week in this program for the last couple of years, I've been able to go to a resource from clinical scholars in the leadership program that's helped me deal with a challenge I'm dealing with in my daily work. As a manager, as a residency director, working in an academic setting. And so just-in-time learning, having a module to go to or a resource has been super helpful. Diversity for me, one of the most first powerful things that occurred as part of the program for me was the first time all 4 leadership programs that we had mentioned in the very beginning got together. I entered a room with about 100 people in the room, and for the first time in my whole life, I looked around the room and I was only one of 2 Caucasian males in the room. And that was super powerful for me from a standpoint of seeing that this work is touching all of us, and it's the diversity inclusion aspect of this leadership program is a huge part, and it's a hugely important part of the program. And I continue to have those types of experiences in our on-sites and in a lot of the work that we do, which I think is really important. And then I think you have the opportunity with depth versus width. That for us, I've always been kind of a width person. I just kind of get involved in lots of things and might stay a bit more superficial. I've laser focused on children with special health care needs as the population that I'm going to focus on for not only my clinical scholars work, but all the other work I do in scholarship as an academic. So whether it's my work in committee work at the American Academy of Pediatrics or the American Academy of Pediatric Dentistry, or working with organizations in my state. And so really it gives me those skills to also really go deep in this area and build those deep connections with partners at all different levels across the community and organizational levels to really make a difference. So I'll stop there, but those are just a couple of things that really have been an experience for me over the last couple of years, and I look forward to more in the third year.
Great. So I'm just going to move to the last slide that has my contact info as you start to think about how you might your next steps, and one of those might be starting your application now so you can know what we're asking for, get your letters of reference put out, and also let us know if you have questions as you're working on your application. And then I'll if there are any additional remarks or suggestions that you all have about ways that we can better engage dentists moving forward.
As far as that application goes, will you send us an email or something with those links so that we can review the application?
I can absolutely do that. Who was speaking just now?
This is Tom Olinger. Tom Olinger.
Tom Olinger. Okay. So I don't know if I do. If you registered, I have your email address, and I will send that.
Right.
If you did not register and just found a Zoom link, then if you could put your email in the chat box, I will definitely have your email address and be able to send that to you.
Okay. All right. I did register, but I'll put it in there.
I do have yours, but I don't think I have one for Daniel Nam. So if Daniel's proxy can share that with me, that'd be great. And then again, if you have a suggestions of how we can continue to let dentists know about this, please let us know. And then we had the slide that just had some additional reflections that Jeff had about the program. Are there additional reflections that you have, David, or recommendations for someone who might consider applying?
I think in my case it was the exact opposite, where I was laser focused on one illness and one patient population, and this has enabled me to broaden out. I can't stress enough the lessons learned from leadership, the lessons learned about myself, the teams that you can build to address a local issue that you might not have been aware even existed at the beginning of the project. We literally are, I think, continuing to make a difference. And I think that if you, like I said before, if you're passionate about an issue, you want to participate, you want to give up some of your time, it's more than worth it. And no matter what stage you are in your career, as long as you meet those 5 years of minimal clinical, it's definitely incredible. And like I said, one of the better things that I've been given the honor of pursuing. So I recommend it. I have my email if anybody has questions, and Jeff did the same on how we put our team together, how we identified the problem. We did do our homework, and we had been trying to address, Charles and I had been trying to address this before, and now with Hope and the three of us, we are making a difference. And I think if you can look at a 3-year grant project and say, yes, we're making a difference, then it's very powerful. Then I think everybody who's on this call has that ability and can make a difference in your own community, addressing your own wicked problems, whether as a team lead or just as a member of the team. It's a remarkably worthwhile experience. From the personal coach to the team coach to the on-site learning, to the modules. If you do get accepted, you'll hear the words, there's a module for that, and you might dream those words. There are modules that are remarkable and help you with day-to-day issues that you face. And I don't know how else I can say it. Pursue this. It's worth it.
Thanks, David. So Janet, do you want to close us out with any closing remarks that you have from?
Well, as a National Advisory Committee member, I just want to thank everybody for taking the time to come and to hear from some outstanding clinicians and members of our clinical scholars group to talk about their experiences in the program. And I think the program is really positioning those individuals who are participating for what's coming in the landscape of healthcare as it relates to learning to work with interprofessional and interdisciplinary teams on a regular basis, not just as we decide to do it. I think as healthcare is starting to demand that we have these teams and that they're very high functioning. And the only way we can do that is to continue to work to get to the point where we actually, it is not something we're working really hard to do, but it becomes second nature.
Well, hopefully that was great remarks. Hopefully this is the beginning of folks feeling more charged and inspired to pursue beginning your application. And we've shared a couple of different contact information with you, and I'll follow up with additional links directly to our application and more details about the current teams. And I will say, once you start the application, there actually are sample narratives. So that's also been helpful for some of the folks who've applied to see, like, where do I start? At least having a sample narrative, it can be a resource, and there are a number of other resources to take advantage of. So I just want to thank everybody for joining us when you could have been doing something else during this hour. And again, really encourage you to take advantage of Clinical Scholars. Thanks again.
Thank you.
Thank you.
Thank you.
Thank you. Good luck.
All right, I'm done with that. Let's come.
Bye, Janet.
Janet, yeah.
Okay, how do I get off of this thing?
I'm just going to end it for everybody, so you should be good.
Okay.
Let's see. Here we go. All right. Thanks again.